cities all around the world, all continents except Antarctica. You might be looking at this rat map and saying, huh, what's going on over here? This little blank space. That's Alberta, the rat-free province of Canada. Hilariously, where I'm from. So originally from a place that has quote unquote no rats, we do actually have rats. There's many fewer of them, but Alberta has marketed itself as the rat-free province. But they are everywhere. And so I started studying rats 11 or 12 years ago. I came to do my PhD, and it has been a truly wild ride ever since then. I joined the Vancouver Rat Project, which Dr. Chelsea Himsworth started back in 2010. You'll hear from her soon. And then things really just took off. Since then, I have handled 700 rats myself. You're looking at a picture of me holding a rat, testing for disease. That is a artist's rendition of me doing the same thing for a children's book about urban ecology. We've done documentaries about rats. Bobby's in this one too, called Rat City. So it's been really interesting. I never would have thought that the media and the public would have been so interested in rats, but it turns out they're just so charismatic. And it's exciting to come to New York. I have been twice before, both times also for rats. And you come to the city and you go, oh, I'm going to get to see some celebrities, like from Canada, especially where we have almost none. We say, yes, this is so exciting. But of course, the celebrity we all would like to see, Pizza Rat. And I have, Maureen and I were out last night looking for rats. We did indeed go on a rat safari. It was delightful. New York has really showed up. So haven't seen Pizza Rat yet, but fingers crossed it'll happen before we leave. And so that is an introduction to me. I will say that the work that I'm going to be presenting on today is largely work from the Vancouver Rat Project, also the Chicago Rat Project, and collaborative work with folks here in New York. So we are going to talk about a few different things. There are so many other people who are involved in this. This is just a few. Dr. Chelsea Himsworth, Dr. Maureen Murray, and Dr. Matthew Combs. Matthew, are you here? I haven't seen you yet. Oh, hey, you front row. I have terrible eyesight, so that makes sense that I didn't see you. And the framework that we're going to use when we think about talking about health and rats is a framework called One Health. So the basic idea behind One Health is that your health isn't just about you. Your health is also about the health of animals in the environment and the environment itself. So to move towards collective health, for all of us, we need healthy people, healthy animals, and healthy environments. And what's really helpful about this framework is it moves us away from just thinking about disease to thinking about the mental health impacts that Mayor Adams spoke about earlier, which certainly we'll get to in the latter part of this talk. Rats are more than just disease risks. They also impact our mental and emotional health. But we're gonna break it into two parts. We'll start with zoonotic diseases. Those are the diseases transmitted between animals and people. We often think about the diseases coming to us from animals. We can give them back. So we also can have diseases transmitted from us to them. We'll talk about those too. And then we will talk about the mental health impacts of rats as well. And rats are quite famous for the diseases that they carry, and they do indeed carry many of them. And you would think then, because they're so famous for carrying diseases, that we would know what those diseases are that they carry. But we did a study in Chicago where we surveyed residents about their knowledge about the diseases that rats carry, and we asked them about two that they do. So we've got leptospirosis and hantavirus, and we also asked them about rabies and West Nile virus. They do not carry those. And what we found is that people actually really don't know what diseases rats carry. So they didn't know. You've got here people saying, yes, I think rats carry that, not sure, or no. You've got quite a few not sures. You'll notice lots of confidence in rabies. Again, they don't carry rabies. And we did find that some folks did know about leptospirosis, which rats carry, but those tended to be people who owned pets, dogs. Dogs can also get leptospirosis, so it might be that folks are getting information about leptospirosis from their vets, their veterinarians. And so in general, we found there was a real lack of knowledge about the diseases that rats carry. Pet ownership might play a role in knowing more about rats, but that there's also quite a bit of misinformation about diseases that rats carry. So we're going to talk about a few of them, and we're going to break them down into rat origin diseases and human origin. So rat origin are the diseases that rats themselves carry. They can give to us. We think of them as reservoirs for that disease, as the carriers of it. And then human origin are the fun things that we carry that we can then give to them. Oh, and there's a bunch of them when we think about rat origin. So I'm throwing a bunch of Latin at you, but you've got Yersinia pestis, that's the causative agent of the plague, Rickettsia, Bartonella, Leptospira, Streptobacillus, Sole hantavirus, and hepatitis E. And the little logos here on the side, or the little icons, those are bacteria at the top, viruses at the bottom. So quite a few bacteria and a couple viruses. We have to talk about the elephant in the room, of course, which is the plague. That's the one that we always think about when we think about rats. And certainly, plague has been the cause of millions of deaths historically. But it's actually not that common today. It's quite rare, especially in North America. We don't really have plague outbreaks. Outbreaks are most common in Madagascar and Democratic Republic of the Congo. We do have some outbreaks there, often associated with rats. In North America, so we've got a map here of the United States, and on average, maybe about 7 human cases of plague a year. They tend to be associated with fleas from prairie dogs, even squirrels occasionally. But in North America, we're not really thinking about rats and plague. And I mean, also for the plague, the rats are kind of like, don't look at me. It's not me. I'm not doing it. And that's because plague is transmitted by the fleas on the rats. So rats are really, the fleas are the vectors. So the rats die, the fleas jump off, and they go on to people. And actually, there's some contention about the role that rats have played in past outbreaks. There's some science that suggests that some of the past outbreaks were actually due to ectoparasites on people being spread between people. So we don't really know the full extent of the role that rats played. But certainly, it was really the fleas that were the culprit. And ultimately, rats don't do well with the plague either. That's part of the problem. So they get the plague, they die, and then the fleas jump off the rats and onto people. So when do we worry about plague? When we start seeing streets filled with dead rats, I think then we start worrying that maybe we've got a bit of an outbreak on our hands. So let's talk about some of the other ones that we do see in cities in North America that can pose a health risk to people. Again, when we're looking at this here, many of these are bacterial pathogens, a couple viruses. And they're transmitted in a number of different ways. So the top here, Yersinia pestis, Rickettsia, Bartonella, those are all flea-associated pathogens. You'll see a little flea icon there, or ectoparasites. Lice can also play a role. We've got Leptospira, that's transmitted in rat urine. Streptobacillus, that's the causative agent of rat bite fever, so biting from rats in their saliva. Sole hantavirus, that's their excreta, so feces and urine. And hepatitis E. Hepatitis E is kind of a new one. We've had a couple cases recently of rat hepatitis E jumping to people. And so this is raising concerns that it could be a zoonosis. Well, it is a zoonosis for people. We don't really know the scale, and we're not entirely sure how people get it. We think probably through feces. There could be some other ways that they can get it too. In Vancouver, wow, we've got more than 50% of these. We've got Bartonella, Leptospira, Streptobacillus, hepatitis E. That's all just one neighborhood. So rats in the places where we've studied rats in Vancouver carry a number of these zoonotic rat origin pathogens. The good news, most of these are bacteria, so are treatable by antibiotics, but there is rising concern because we do have a rise in antibiotic resistance. And so what's treatable today may not be treatable 10 years from now, 20 years from now, and that's a real concern. We did a review paper looking at antibiotic-resistant bacteria that rats carry, and here you're just looking at a graph of different bacteria here at the bottom and the antibiotics that they've been found to be resistant to. And you'll notice that they carry quite a few bacteria that are resistant to antibiotics. And the troubling thing is that we have a few of these that are resistant to multiple antibiotics. And that's when you really start to worry, because the more antibiotic resistance you have, multi-drug resistant bacteria, it means you have less ability to manage that. And you might be spending too much time in trying to treat it, right? You treat with one antibiotic, it's not working. You switch to another one, it's not working. All the while that infection is getting worse and worse. So this is a real concern. Then if we think about human origin pathogens, they carry a few here too. These are all bacteria. Methicillin-resistant Staphylococcus aureus, that's an antibiotic-resistant superbug. It used to be mostly in hospital settings, but now we see it quite a bit out in community. Clostridium difficile, that's a spore-forming bacteria, causes gastrointestinal illness in people. Salmonella and E. coli, those will be common ones for us to think about, and Shigella. And all of these are transmitted among rats to people through their excreta, so through their feces. And in Vancouver, we have all of them. Good for us, very exciting. So they carry lots of these pathogens that humans carry, and it's probably in part just due to their ecology. They move through the environment, through our waste, and they have the opportunity to pick up these bacteria. And so rats can act like a sponge, picking up these things that we ourselves carry. And we don't fully know yet, but there may be some potential that they can then carry those pathogens and spread them in the environment further. And so definitely more research is needed in this space to understand to what extent rats actually pose a health risk for these human-associated pathogens, but certainly it seems that they can pick these up and potentially spread them. Speaking of human-associated pathogens, I want to tell you about an outbreak of Shigella we had in Vancouver. So we've done all our research in an area called Vancouver's Downtown East Side. It's an area where we have a lot of unhoused residents, the housing affordability. I don't know if you've heard about Vancouver. You can't live anywhere almost. It's very expensive. And the Downtown East Side in particular is an underserved and under-resourced neighborhood, and there is frequent rat-human contact. And we had an outbreak of Shigella in residents, and public health was trying to decide, like, how did these folks get Shigella? And they couldn't find any single point source. So they said, rats? Question mark. And they came to us at the Vancouver Rat Project and they said, can you figure that out for us? We said, heck yes. So we mobilized quickly. We worked with the pest managers. We worked with municipalities. We worked with the local public health office, and we got on the ground and we selected rats or collected rats in the area. So we did some trapping and we tested them for Shigella. And we went one step further. So we didn't just test them, but we also used genomics. And what's great about genomics is you can say, well, how similar is this bacteria that the rat has to the bacteria that the person has? Is it similar, or are they too different? And what we found is that they were essentially carrying the same strain. They're very similar, very related, Shigella. So rats were carrying the Shigella. Now, the problem with genomics is you can't say who gave it to whom in this case. Probably the rats picked it up from people. And we don't know if rats actually played a role in giving it back to people, but they were definitely capable of carrying the same Shigella that people carried, which points towards the fact that they could potentially have been spreading it. So that's another area of more research to show in which ways that pathogen is going, but certainly they can pick up the same strain of Shigella. So one takeaway, genomics reveals pathogen transmission. I'm really excited with the advancement of genomics. We're going to be able to answer these questions a lot more robustly in the coming years. I'm going to talk about a few other diseases. Before I do, I like to show a picture of how we do this work in Vancouver, because when you're collecting rats, you're testing them for diseases, it has to happen on the ground. It has to happen quickly. We're collecting urine, feces, blood samples. We would put rats under anesthesia and collect the fleas from them. It was like a little rat spa. They would go in and we'd collect all the fleas and send them back out into the world. So you're looking at a 90s rendition of a Vancouver map on the left and the Vancouver rat van on the right. And over top of these containers, you're looking at the rat traps. So we would put rats on top of these containers that we bought at IKEA or the dollar store, and then collect the urine and the feces that would fall through the traps into the containers. And then we had a little segment there at the back where we could put rats to sleep and grab samples. And so thinking of the diseases that we collected in rats from this neighborhood using this method, here you're looking at a vial of rat urine. One of the big ones that we think about is leptospirosis. Leptospira interrogans is a bacteria spread by rat urine, and we have 1 million cases a year globally. It is probably the most widespread zoonotic disease there is, and we see 60,000 deaths globally. So we don't see a lot of cases in North America. It's very common in areas that have flooding warmer areas that see more rainfall. Here's a map of leptospirosis cases from a review, and what you'll just see is that leptospirosis is pretty much everywhere. Rats aren't the only animals that carry leptospirosis. Other mammals do too and shed that bacteria in their urine, but it is globally distributed. Risks for leptospirosis then, flooding events. So when you have flooding, folks are out walking in water, maybe they've got cuts and abrasions on their skin. That's how you can get leptospirosis. Also contact with contaminated soil, foods. When you get leptospirosis in people, it looks like a flu-like illness. You have like a fever. And one of the problems then is that if you go into the doctor and you say, I've got the flu, they look at you and they say, you got the flu, go on home. So when you show up, let's say you have leptospirosis, folks aren't necessarily testing you for leptospirosis. So even though we don't necessarily see a lot of cases, it's really underreported. So we don't have a full scope of how many people actually get leptospirosis in our cities. And so when we think about managing, then we need to come back and think about infrastructure, how people are exposed, our sanitation, standing water, all of that in reducing exposure to leptospirosis. I wanted to, talking about human cases and reporting and cases. We did a video about rat management and we actually compared New York and Vancouver. So you're looking at, I don't know why New York has the rat on the Eiffel Tower and, you know, they're getting attacked by these helicopters. But anyway, Vancouver is rat free. Did you know? It's on the left here. Anyway, so New York and Vancouver, we did a study in Vancouver where we actually looked at folks as part of another study to see if they'd been exposed to leptospirosis in that downtown East Side neighborhood. There were 202 folks who were part of that study, and we didn't find leptospirosis in any of them. And that was interesting. Some people, I think we had 6 people, 3% had contact with Bartonella, another rat-associated pathogen through fleas, but we didn't actually see any cases of leptospirosis, which was a little bit surprising. But it seems to suggest that at least in that neighborhood, we haven't seen that transmission, or transmission might be quite low. In New York, last year you had 24 cases, already 6 this year. So some indication that folks are getting sick from leptospirosis. And again, this is likely an underestimate because it shows up like the flu. And so we don't have a full scope of how many people get sick, but certainly there is a risk, and we do have evidence that folks are coming down with leptospirosis in our cities. So for rat-associated pathogens, one of the real challenges is that we see few cases, but that it's underreporting. So it's hard to know the full scope. But even more intriguing. So rats carry these pathogens like leptospirosis, again, all over the world and in our cities. It's all throughout the city, but it's not evenly distributed in our cities. So some areas have higher concentrations of leptospirosis than others. I'm going to show you a few studies that speak to this. This one's in Chicago, where Dr. Maureen Murray's team trapped rats throughout Chicago and looked for leptospirosis. So you see these circles here. The fully white circle is saying there was rats, but no leptospirosis. And the little part of the pie here, the black part of the pie, that's where rats had leptospirosis, the proportion. And so we had leptospirosis sort of throughout, some areas more than others, but the areas where there was more leptospirosis was associated with higher complaints about standing water. So areas where we had more standing water had higher amounts of leptospirosis. And again, leptospirosis, rat urine, contact with water. So that makes sense. So when we're thinking about managing leptospirosis in our cities, using something like standing water complaints to understand where we have that standing water and potential risks could be really helpful. But even if you have variability throughout a city, you also have variability at the level of a city block. So here you're looking at a map of the downtown East Side in Vancouver, and all these blocks are outlines of the city blocks where we trapped rats. And the green circles are rats that were caught and were negative for leptospirosis. And the red are the circles where the rats had leptospirosis. And you might look at this map and go, well, that area is a problem. That's troubling. And indeed, it is. But we had so much variability in where rats carried leptospirosis. So in one city block, 60% of the rats carried leptospirosis. And then you could go across the street and none of the rats would carry leptospirosis, even though there was some, or there were rats. And what that suggests is that your risk of a rat-associated disease depends not only like on your neighborhood, but the city block you're standing in. So there's so much variability in where these pathogens are. And so we asked, what's up with that? Why is that? Why do we see this difference? And ultimately, we decided, well, it probably comes back to rat ecology in some way, something about how they move, they interact with each other. And this was a large focus of my PhD, was trying to actually just follow rats around and figure out where they were going. Very glamorous work. And so we did a few different studies. We trapped rats, we released them, we put ear tags on them to see who they were, where they were going. We trapped over 100 rats more than once, and we found only 8 of them moved between city blocks. Very little movement. Okay. We also used genomics, where you actually take the DNA of those animals and you map up how they're related to each other. So here at the top, you're looking at parents and their offspring. You're looking at full sibling rats, and you're looking at half siblings. So 50% sharing DNA, 25% sharing DNA. And the lines that you're seeing between individuals are related pairs. And what you'll notice is there's very few cases where related rats are in separate city blocks from each other. 99% of related rats were found in the same block as their relative, and we caught like full siblings in the same trap. It was wild, actually. I expected to see them move a lot more than they do. And I will say this is I've got it here, but 700 rats. And so what this suggests is that rats aren't moving all that far. And if they don't move, they're not spreading their diseases. So that could be how you end up with this block by block difference in the number of rats carrying disease. We also saw this with another pathogen. So this hepatitis E I mentioned earlier. So folks do get hepatitis E. They often get it traveling. It's more of a swine, like pig-associated zoonosis. But there have been a few recent cases in folks who've come into contact with rats. And we did a study just recently looking at hepatitis E in rats. So again, downtown East Side neighborhood on the top. And on the left, you're looking at all the different hepatitis E virus that we got from each rat. So each one of these little circles is a different rat. And we've got some here in red, some in blue. And the red and blue shows rats on one side of a busy street, that's Main Street here. And so we've got red strains on the left, blue strains on the right. And what you'll see in this tree is that they cluster. All the reds are together, all the blues are together. And what it suggests is that roadways are acting as this barrier to rats, especially major roadways, because we didn't see this pattern across minor roadways. And that even that kind of barrier can affect virus evolution. So preventing rats from moving between these blocks can result in these different lineages of viruses, which is quite interesting. And so this can be used to help inform pest management when we're thinking about, where is the risk? How many animals carry that disease? What scale are we going to do our rat management at? So risks are location specific. It's not even throughout a city. Different neighborhoods, higher risk for different reasons. Different city blocks, different risks, different reasons. And the plot thickens even further than that. Because we were really curious, okay, if you see this clustering of disease, and that's because rats don't move that much, what happens when you disrupt rats? What happens when you make them move? What happens when you challenge the structure of their colonies, which is essentially what we do with pest control, right? We go in, we kill rats, we remove them. Rats live in tight social groups, they interact with each other. And so removing rats could change that ecology, that interaction. So we did a study where we were trapping rats and we were releasing some in some blocks. And then in other blocks, we trapped rats and we removed them to simulate pest control. And we looked at 3 different diseases. We said, okay, what did the disease look like before? And what did it look like after we did that pest control intervention? And we looked at 3 diseases transmitted 3 different ways. Again, Leptospira, rat urine. MRSA, rat feces. Bartonella, fleas. And we saw 3 different things. So for Leptospira, in the blocks where we removed rats, afterwards, we saw more rats carried Leptospira. Didn't change in any of the other blocks, but in the blocks where we did pest control, the number of rats carrying Leptospira increased. Uh-oh, well, that's not great. MRSA, we didn't see any difference. And we kind of expected that because, again, MRSA is something they get from us. It's not really necessarily based off their interactions with each other. So that we expected to see. Bartonella was a bit confusing. Throughout the study, the number of rats carrying Bartonella increased everywhere, except in the blocks where we removed rats. So it didn't necessarily decrease Bartonella, but it prevented it from increasing in a way. So we saw 3 different diseases transmitted 3 different ways and different impacts of pest control interventions. And why is that? Well, we think it's because, rats, again, they live in these tight social groups. When you remove some, you change how they interact with each other. In the case of leptospirosis, where it's transmitted in rat urine and you can get it through bites on your skin, well, perhaps removing rats changes how they interact with each other, and they're changing how they fight for their social hierarchy. And they do urinate on each other that whole time. So it could be you remove some, you increase the spread of leptospirosis. With Bartonella again is on fleas, and most of the fleas that rats encounter are in the nest, and they share nests. So if you remove some rats, maybe you're reducing nest sharing, and that could potentially result in this preventing of it increasing. But what I would love is actually like a rat cam that I can put in the nest so I can actually see how they're interacting with each other, because we don't know. We don't really know why we see these differences. But what we do know is that pest management and other actions similarly can have unintended impacts. And if our purpose is to reduce the harms associated with rats, sometimes our actions can make it worse. Another thing that can impact disease potentially is the use of anticoagulant rodenticides. This is a study that was led by Dr. Maureen Murray, and you're going to be hearing more about rodenticides later. But essentially in this study, what we were looking at, or they were looking at, was where rats carried E. coli on the right, Leptospira in the middle, and then this here is where rodenticides were detected on the left. And at the top, you're looking at E. coli Leptospira for rats that were unexposed in the light blue and exposed in the dark blue. What they found is that rats that carried Leptospira or that had been exposed to rodenticides were more likely to carry Leptospira than rats that hadn't been exposed to rodenticides. We don't know why. It could be perhaps rodenticides make rats more susceptible to Leptospira. That's potentially one case. Or maybe if you have Leptospira, you're more likely to eat a rodenticide. We don't know, but certainly there's an interaction here between being exposed to rodenticides and carrying Leptospira, but stay tuned. That's going to come up in another talk all about rodenticides after Chelsea's talk. So why should you care? As managers of rats, of people who work in this space, why should you care about the ecology of these animals and the diseases that they carry? Well, the first is that knowing what diseases they carry and where can help inform where you do your control. Maybe you pick areas that are higher risk, areas with standing water, for example, if you're trying to deal with leptospirosis. So it can help you decide, where you're going to target your efforts, because money is limited. You can't be everywhere, right? It can also help you think about the scale of your management. Maybe you do it in the areas, like a whole neighborhood. Maybe you do it at the level of a city block based off of the diseases they carry, and knowing that rats don't tend to move maybe all that much. Again, that depends. That's in Vancouver. It might be different depending on different cities that you go to. Or it also helps you think about unintended impacts. So the consequences of the actions that we do. All this comes down also to good program management and planning. So when we are doing our pest interventions, considering the impacts on the disease is one part, and being able to actually track that over time to know if we're having any of these unintended consequences. And then finally, one thing that we're going to talk about now and move into is the mental health impacts. So we talked about managing rats from a disease standpoint, but even beyond disease, rats have impacts in the mental health of residents, and they're worth managing and thinking about how we control them even beyond disease risks. So moving into mental health. This is a This is a topic that's really near and dear to my heart. When we were doing the rat work for my PhD, I spent 8 months like essentially living in this van, trapping rats. And I was really zoned in on diseases. Like, here's all the diseases that rats carry. I need to go out and I need to find them. And then I talked to people who lived with rats and heard their stories about the impacts of rats on their lives. And I realized that for them, it was actually much more than disease. This was actually the bigger issue, was intersecting with rats all the time. And I feel really grateful that I've been able to capture some of their stories. We're going to share some in a little bit, but this to me it's still really understudied and underappreciated. And Mara Adams talked about this earlier. I really think that the mental health impact is much more significant in some regions, like in North America. And I've got that here. Is it a greater health risk? It's persistent, it's pervasive, it's something that you interact with all the time. And maybe you're not being exposed to disease, but just the thought of rats carrying disease and being in close contact with them is an everyday stressor. And these impacts vary. Something that we'll talk about in a little bit is that it's more than just the rats themselves. Rats are symbols for other things. They're symbols about a lack of resources in your community. They are a symbol of managers or what people view as the city officials not taking their health seriously. So rats are a symbol way beyond just disease. So we did a study in Chicago looking at the relationship between exposure to rats and depressive symptoms. So we used an established scale here on the side. It's the Center for Epidemiologic Studies Depression Scale, and it asks a number of questions. So we put this in our survey. We reached out to 589 folks in Chicago, and we also looked at their overall depressive symptoms here on the left, and underneath how frequently people interacted with rats. And for people who interacted with rats daily or almost daily, they were much more likely to report depressive symptoms. So those daily encounters with rats were impacting their mental health. And here we've got daily exposure was associated with 5.5 times the odds of high depressive symptoms. So much more likely to report depressive symptoms. And importantly, this was not evenly distributed across people. So here on the left, you're looking at income. The black triangle is folks who make under 50K. The circle down here is folks who make over 50K. And what we tried to do is understand the impacts that people were reporting. So we asked them, do rats impact how you feel about where you live? And for folks who said, yes, rats impact how I feel about where I live, people who made under 50K were more likely to report depressive symptoms than folks who made over that amount, showing a difference in income. We also looked at folks who saw rats daily and high depressive symptoms, and folks who didn't see rats daily and high depressive symptoms. And we found folks who identified as white, it didn't really make a difference if they saw them daily or not daily, had about the same amount of depressive symptoms. But for folks who didn't, seeing rats daily was associated with higher depressive symptoms. And that was partly because those folks were also exposed to rats more frequently. And so this was highlighted at the very beginning, but rats are a social justice and health equity issue. Just like heat in cities, just like exposure to pollution, it is environmental justice. Some communities are impacted more than others. It comes down to access to resources, community services. And so when we're thinking about managing rats, really argue that this is also why we need to do it. Even beyond disease, it is health equity, it is health justice. One of my favorite things about doing this kind of work is, again, talking to people and hearing what they actually say. So I can show you lots of statistics, I can show you graphs, but ultimately it comes down to what people are saying in their own voices. And so I want to share with you a few quotes from Chicago on the left and Vancouver on the right of what folks actually said about rats. So in Chicago, I'm always afraid. I live in a low-income area and there are rats everywhere. In Vancouver, if you could count every rat that goes by, there's probably more rats around than people around the streets. Daily exposure to rats, and often in close contact in both cities. Chicago, I didn't feel safe in my home. I was nervous to fall asleep, of fear, in fear of what they might do while I'm asleep. It was psychologically traumatic. Vancouver, the visual, somehow that's expected. I don't know. But the noises, you don't know what it's going to sound like, or the power that's there in their little feet or something. The power in their little feet. This same person talked about the sound made by rats at night being like 2 6-foot guys moving furniture. It's just like such a specific sound to recall. And folks often talked about not being able to fall asleep, fear of rats biting them in their sleep, just the noises keeping you up at night. In Chicago, I fear going out at night as I often encounter rats running through the yard and in the street. I'm unable to use my back patio after dark. It's your space and you cannot use it because you're afraid. In Vancouver, even when we're doing the garden, there was rats. And I used to love working in the garden, volunteering, but now I won't go because of the rats. You have two situations here where one person can't even feel safe in their own backyard, and another person who used to volunteer and no longer can because they're worried about encountering the rats. And I've been to that garden. There were a lot of rats. And what's really troubling about this is from a stress and anxiety standpoint, social connection and ability to be with others actually makes us more resilient to other stressors in our lives. And if we can't do this because we're concerned about rats, it makes us much more susceptible to the other things that happen in our lives that cause us stress and anxiety and affect our mental health. Chicago. It's very frustrating when building neglect and slumlords ignore their properties and rats take over under garages and buildings. It makes me feel unsafe for my family as we see rats daily in our backyard. Vancouver. I don't think they think it's that important. It's the downtown east side, right? So they really don't care about the people down here, because if they did, they would have more housing for people, right? Right? Like I feel that way too. And so I feel like, folks, this gets at this other aspect of power, who has it, who doesn't, and what people actually do about it. And so rats also represent, if you see rats daily in your neighborhood and nobody seems to be doing anything about it, it also symbolizes that the rest of your city doesn't care about you. It symbolizes that officials don't care about you. And so it represents more than just rats. So rats, again, have extensive impacts. They impact physically through sleep loss, as one example. The psychological, the impacts of anxiety and fear. The social impacts, preventing us from engaging with each other. And aspects of power. Again, who has it, who doesn't, what's done about this issue. One of the real problems with rats that we found through the Chicago Rat Project is people talk a lot about how they don't have the power to manage rats themselves on their property. It's their neighbor that they have the rat issue with, or, it's a city property nearby. And so folks often don't feel like they have the power to manage the rats themselves. So rats are a symbol. There was one study, this one down here at the bottom, that talked about rats sort of representing social connection as well. So they did a study where they looked at people being able to have connections with others and found that social connection improved mental health. But if you saw rats all the time, those connections didn't help you. It was like rats trump social connection. It's not ideal. So rats are also, they impact our connection. They represent neighborhood disorder, aspects of cleanliness, and control over one's own space. Okay, where do we go from here? How do we support holistic health for people who live in our cities? And I think the first thing I'd ask is, what's the goal? What's the goal of our rat management program? Is it to get rid of the rats? Or is it to reduce the harms associated with rats? Because those are actually complementary but different approaches. If we come back to this idea of One Health, healthy people, healthy animals, healthy environment, then having healthy rats, in a way, could help with the health of people in our cities. But I would also think, where do people interact with rats? How do we prevent those interactions? How do we keep people safe in their own homes where they're most at risk? And then thinking about, there's down here on the right, you're seeing a video that we did through the Vancouver Rat Project about rats being more difficult to manage, as being harder than rocket science, little tongue in cheek. But rats intersect with our cities and ourselves in almost all ways. They're waste, they're transit. There's so many different ways they intersect with us. And so we need to address that complexity. Rat management is not a simple issue. We have to stop treating it like that and instead map out the various ways we interact with rats and the various ways they can impact our mental and physical health. And so I'll leave it there. There was so many people who are involved in this work. Again, a big thank you to all of them. And thank you very much for your attention.